How do you decide what services should be commissioned?
Well, in Solihull, like all local authorities, we have a Children and Young People's Plan, and that has our priorities for usually for a 3-year period. And a wide range of people have contributed to the plan, including service users, children, young people and families, and a wide range of other stakeholders to kind of plan together, what are the most vulnerable groups in the borough and those children who are at risk of poorer outcomes, so that we need to give some priority to developing services in order to improve outcomes for those children. So it really all stems from our Children and Young People's Plan.
What approaches do you use to ensure what the service user wants is considered?
Well, there's a number of tools that we use. I mean, there's quite a lot of consultations that have been done with children, young people and families over recent years. So we would always look at those first to make sure that we're not asking people the same question again and again. But if we feel we need to do something particular around an outcome that we're focusing on, then we will set something up, whether it's through kind of focus groups with a particular group of children and young people or through questionnaires. So we use consultation techniques as well. But we also look at things like feedback from users of current services where they might be identifying gaps in provision.
What would convince you of a service being worthy of commissioning?
Well, I think to start with, I would say we never start with the service, we start with the outcome, so what is the outcome that we're trying to address? But then we use a whole range of approaches, including the tendering process, to identify the service that we would want to commission. So we specify the outcome and what are the standards that we would like to see a provider delivering in terms of that, what we'd like to happen. And then we use the tendering process to invite people to come forward and tell us what their solution to that particular outcome might be, whether it's a service or whatever it is, and then we would evaluate that using a range of criteria in order to come up with the best solution.
What do you look for when deciding on a provider?
In no particular order, we would look at their policies and procedures. Obviously, it's really important that they've got good employment practice, that they've got good safeguarding practice, that they understand issues to do with health and safety and equal opportunities. So there's a whole range of things around policies and procedures. We would also look at the solution that they were putting forward and how interesting that sounded, and where the evidence based, how they were going to evidence that would improve outcomes. We would look at things like their finances. Is this an organisation that's still going to be here in 3 years' time when the contract is there? We would also look at things like their quality assurance processes. We would look at how they would involve children and young people in what they were going to do. So there's a whole range of things that we would look at.
How can potential providers become known to commissioners?
Well, it has been known for providers to just ring me up and say, can I come in and have a cup of coffee and talk to you about what we're doing? And that's perfectly reasonable to do. And obviously it's about going along to networking events. We often go along to sustain events, for example, so come up and introduce yourself there. We do sometimes have sessions ourselves where we've got a potential for a service that's coming up, so we would invite people to come along and meet us then, and that's about us getting known to service providers, but service providers making themselves known to us as well. So there are a range of opportunities, but commissioners want to work in partnership with providers, so any opportunities people can take to kind of get to know us and us to get to know them, that can only be a good thing.